So as for the second part of the session, I'll talk about this extra study that EuroCore initiated after Katsenos meta-analysis. So on the title of long-term follow-up and mortality of the patients on the Freeway Stent Study. So just to recapitulate, Katsenos showed increased risk of mortality after 5 years, or a sign of increased risk for mortality after 5 years after patients receive paclitaxel, as a series of, as a meta-analysis of many studies, industry-initiated studies. The mortality was also had a dependency with the higher of the dose of the paclitaxel on this study. So the reaction, as we talked about, it was almost a full stop in the use of DCBs from the night to the day after, and there was an attempt, or there was a run for increase in the data and analysis of data in the long term. So many of the studies that were already terminated, or maybe long terminated, or recent terminated, was also influenced to restart this studies, and as also did EuroCore with the Freeway Stent Study. So they restarted this study to analyze the long-term data. So again, you have the Bakuba trials and the Freeway Stent Studies trials from EuroCore, and all the registries for the shunt balloon. All this initial data, they all demonstrated high safety for these patients. So there was no signs of increased mortality for the paclitaxel group in this initial data, but of course, with the Katsenos trial being up to 5 years, you have to increase the follow-up for these groups. And the question is, of course, is there a long-term safety for these balloons for the paclitaxel from the EuroCore? So the effect was that the Freeway Stent Study was reopened, and there was the data was collected for the mortality and other data on the 5-year plus follow-up of this patient, so longer, even longer than 5 years were analyzed. Just back for the Freeway Study, 1-to-1 randomized trial, 204 patients in Germany and Austria, and initially with a 12-month follow-up. So the results for the Freeway Stent Study were very significant for the better primary patency and a better improvement in clinical status for the patients that received the paclitaxel, the Freeway balloon. And the stent was first published in 2019, the study, sorry. So that's the Freeway balloon we just looked at after. So you can see here the 3 milligram per square millimeter paclitaxel coating with the amorphous coating. So again, this picture showing how it works, or how it is composed of a very smooth surface that reduces the loss of the drug on the way in. So the study flow chart for the Freeway Stent Study, for the initial study, was 204 patients randomized 1-to-1, either to receive a 19-0 stent and a post-dilatation with the Freeway balloon, or a 19-0 stent and a post-dilatation with the plain balloon. For the Freeway balloon, 105 patients. For the plain balloon, 99 patients. Follow up 2 months at 12 months. 89 patients for the Freeway, 79 patients for the plain balloon. So what were the results of this trial? After 12 months, you had a significant better results for the DCB, for the Freeway balloon, with a primary patency rate of over 77% against 61 for the plain balloons. You have also a lower rate of clinical driven TLR for these patients on the Freeway group, just below 8% versus over 17% on the plain balloon. And you also had a significant shift for better clinical outcomes for the Freeway balloon at 95.5% and the plain balloon at almost 80%. So what was the mortality on the first 12 months of this study? You had 1.1% mortality, so one patient died from the Freeway group, and 2 patients died on the PTA group with 2.5%. You have a risk ratio in favor of the Freeway balloon of 0.45. That's it's a great result for the Freeway within the first 12 months. So the Freeway, the paclitaxel, was better also not only in maintaining the vessel open, but also in the mortality within this first year. So that's the question for this newer study, for this long-term follow-up. Does this hold up, or is there an increase at the mortality after that? So that's how the long-term data study was organized. You had then, after 12 months, you had a 5-year follow-ups where 66 patients were found, 16 patients lost to follow-up on the Freeway group, 13 lost to follow-up in the plain balloon group, and you have a 5-year inclusion in this study for the Freeway group of 65 patients in the end. And as for the plain balloon, you had 13 patients that on the follow-up received a paclitaxel reintervention. So you have, of course, to take these patients off the study, and we have an end at the end 53 patients for the plain balloon group. A little bit about the demographics. You can see very equally distributed groups. You have no statistical significant difference in the groups, mostly males and over 65 years old with comorbidities. What was the results then from the 5-year follow-up? As you can see here, a clear that the Freeway held up with the lower mortality in comparison with the PTA, ordinary PTA balloon. So you had, after 5 years, a lower mortality than the PTA balloon, and at 13%, 0.1% versus 13%, that gives you a risk ratio of 0.18815. So that proves that even with this receiving the drug, these patients lived more. There was reduced risk of dying on the Freeway group than within the POBA group, as you can see here, also within the confidence interval below 1. So it proves that the Freeway balloon had a reduced risk of mortality in comparison to the POBA. No. So, everything okay? So also you can also see that this trend, it goes on even after almost 12 years. So you have data for up to 11 years, very good data, 12 years also, that this better outcome for the Freeway balloon when comparing to the POBA, it kept going. So this curve shows that every time there was also a better outcome for these patients within the Freeway group. So there was a reduced risk of dying on this group of the Freeway balloon. And here at the cut on 5 year, that was the premise of the study, but they kept going up to 12 years. So EuroCore went further and also analyzed the causes of the deaths. Was there any accumulation of a specific type of death? So not only they analyzed if the patient died or not, but what they died for. So was there any trends of dying of a specific cause for the paclitaxel group, despite of having lower mortality ratios? And was it also dependent on the doses? So as you can see, there was no trend for any accumulation of any cause of death within both groups, actually. You have with the control group, you have an increased chance of dying of cancer, but you also have that on the freeway. It doesn't run to any specific cause of death in any of the both groups. So there was no trigger for any sort of specific cause of death within the paclitaxel. On the demographics, you can see alive versus deceased patients. And it is also very interesting to see that the premise hold up. The only statistical relevant demographic here is the age of the patients. So it's very interesting to see in evidence-based medicine that the older the patient is, the more chances he has to die. That's something we are all sure about, but it's very nice to see it on the paper. So you can see here the median for the deceased patients was over 70 years, so they were older patients, they had more risk of dying, and it was also statistically significant. All the others demographics are non-relevant. So was the dose also a study parameter? So the alive and the deceased, they receive almost not the same dose, but not any statistical difference on it. So the drug dose is also not one, doesn't make any difference on either the deceased or the alive group. Even with subsequent re-interventions, it's still a P of below 0.4. So the conclusions then for this long-term trial for the Freeway study show that a lower mortality risk for the Freeway balloon. So the paclitaxel also in this study had a lower risk of death than all the others, than the POBA group, up to 5 years. So you had a higher survival rate for the DEB. Even after these 5-year marks, it held this trend over the years. There is no difference in more doses or less doses of paclitaxel in the alive or in the diseased patients, and there is no trend for any accumulation of causes of death in both groups. These are the centers that took part on the Freeway Stent Study. That's us here in Flensburg, Germany. If you have any questions, I'd be happy to answer your questions. And thank you very much for your attention.